and Liliana Partida with us today. Welcome.
Welcome. Thank you, Rena. It's great to be with you.
Nice to see you again,
You're
Rena.
doing a documentary, as I understand, and it's called Beyond Chemo, and it's got some great talent and great doctors. So on this episode today, Dr. C, we're going to talk a little bit about chemo and, of course, the newer treatments that are better than chemo. Now, what's interesting is, as you and I were chatting a little earlier, chemo is ancient, right? What, from the 1950s?
Right. It's been around for a very long time.
And in terms of how well does chemo work, what are the statistics on that?
Well, actually, that's a very good question because people think, well, I did this surgery, I did this chemo, I did this radiation, and 6 months later, a year later, the cancer's all back. So obviously, we have to understand that surgery is not curative. Chemo and surgery together are not curative or alone. And adding radiation, all three of those are not curative. Because why? Surgery, if you do surgery, the doctor cannot see the microscopic cells. Not to mention that surgery is an injurious, immunocompromising, and emotionally compromising process. Second of all, if you do chemo, the cancer may be receptive to the chemo, so sensitive to the chemo, somewhere between 7 and 40%. So that means there's all these population of cancer cells that the chemotherapy did not get. Then if you do radiation, there are cancers that are not even sensitive to radiation. Some are 0, some are, at the most I've ever seen is 45% because I do special testing to tell me what chemos work, if radiation and or hyperthermia work. So even if you do all three of them, there's not 100% cure kill rate. We know that the survival, Nixon declared war on cancer in 1970, the survival of cancer is 2.3%, published in multiple journals. Okay, the cancer rates are the highest they've ever been. What are we doing? We're not doing what's right. The cure for cancer is prevention. But if you don't prevent and get cancer, surgery, chemo, and radiation may be just first of the 3 steps that you may need to get control of the cancer. But if you do surgery or chemo or radiation, you must do these other complementary therapies because you have to understand the why, where, when, and how did you get cancer from the beginning. Cancer is caused from a lifestyle and way of eating that you were doing. And if you haven't changed your lifestyle and your way of eating, you still have the same environment for the cancer. That's why the survival rates are still the same. Plus, we're living in this outrageously toxic world on multiple levels in our body. And if we don't change the environment and create an anti-cancer head and environment of our body, we're going to have the same place, same nest. Not to mention, if something is a millimeter in size growing, just 1 millimeter, that's 1 pencil line, it starts releasing circulating tumor cells. Surgery, chemo, and radiation does not exterminate or terminate circulating tumor cells. Those are responsible for 95% of metastasis. So they're looking for a new home, nest, or residence. And then if you haven't changed your lifestyle and eating, the cancer comes back in a month, in 3 months, 6 months, in a year, maybe 2 years. But still, you must have a very complete evaluation by a doctor who talks to you about your eating and your lifestyle. If the doctor does not talk to you about eating and lifestyle, then you need to find another doctor because there isn't a book that abounds on health that doesn't talk about your eating and lifestyle. Not a book. I've never seen a book that doesn't talk about that. Is that correct? And there's thousands of books written, and they all say the same thing in a different way. Correct? Oh, what happened?
Did you know?
And yet, there are thousands of doctors that on a daily basis are telling their patients that there is no link, that they have cancer, but that's fine. They can continue eating whatever the heck they want. And I know that because I've had so many friends who've been touched by cancer. In fact, we lost a dear friend's daughter to cancer about 1.5 years ago. And when I, spoke to the parents and I said, "What have you done nutritionally? What are you doing?" And she goes, "Well, the doctor says there's cancer has nothing to do with that, so we've not really changed anything. So that poor girl, and they kept saying, well, the doctor says, it's 95% success rate because she had one of those cancers, that apparent, leukemia, where they say, oh, it's totally fine. If you were going to get cancer, this was the best kind. It's totally reversible. She'll have like over 90%. It did go away, and guess what? It came raging back, and she was gone within 6 months. And the doctors never told her to change her diet or her lifestyle.
Right. And the World Health Organization publishes, though, why we have cancer. Eating and lifestyle. If you just Googled that, you would see it. So how can that possibly be when it's absolutely not, when your body is a biochemical machine? Of course, it is function.
Exactly.
Yes. So we have to change people's minds, and doctors need to change, though.
Negligence.
That's exactly it. Or, as I say, that might be harder to change. We have to empower people to take charge of their health. So that's where Dr. Connealy, thank you for doing this, because our goal is to empower people that are listening to take charge of their health and to be able to go into the doctor's office and say, I don't care what you say, I'm changing my nutrition and my lifestyle. And Dr. Hughes, you make such an important point. If your doctor's not talking about it, find another doctor.
Yeah, because there are doctors that will talk about it. I know there are, because
yes.
I ask patients, I said, no, you just need to find another doctor. But you must combine some of the conventional with the other complementary therapies. It might be IV vitamin C. It might be hyperbaric. It might be lymphatic drainage. It might be purification. It may be herbs. It may be endo laser. It may be different kinds of IV therapies. There's all kinds of different IVs that are anti-cancer, that are non-toxic to the patient. So, and the scientific validation of all these is everywhere. It's not like it's absent from the internet or the literature. There's PubMed articles on all of these things. So, but we have to figure out what works best for each individual patient. No person is the same. And now some of my patients come to me, they don't want to do surgery or chemo and radiation. They're looking for something completely different. So we do find other ways that we can help the patient.
Let's talk about that. Let's talk about that. So what is beyond chemo? What are the options that others have, and what's working?
Okay, well, it depends. Again, there is no one set protocol for each patient. I would tell you, first and foremost, what someone puts in their mouth and how they live their life and how we teach them to clean up their body has a lot to do with their outcome and if they shrink their tumor. Just fasting. I tell people, it doesn't cost money to fast. If you're concerned about money, go on a fast. I told a patient the other day, they need to go on a 30-day fast before they do anything. They had diabetes, cancer, all these comorbid problems, and I go, just go on a fast before you do anything. Because the doctors jump into surgery, but your hemoglobin A1C is 7. I go, you can't go into surgery with your hemoglobin A1C as 7, because that causes increased risk of infection, increased risk of your body not healing. How can you do that? So I was against you jumping into surgery, because guess what? You prepare the body for surgery. I do an entire preparation mentally, emotionally, and physically before anyone ever does a surgery. Every doctor should be doing this, because the outcome is going to be dramatically different if you prepare the patient on all those levels. If their vitamin D level is low, for example, well, vitamin D influences over 2,000 genes in your body, and you haven't proper sufficient levels. Let's say you have 10 nutritional deficiencies. How are you going to heal after surgery? So before I even have my patients do surgery, I have them do all of that. They see Liliana. I always tell every single patient, the first 2 things you're going to do with me, I don't care what it is learn how to eat and understand the science of food with Liliana, and learn how to resolve emotional conflicts. There's no sense in moving forward if you haven't done those 2 things. You're not bad if you have an emotional complex. You're not a bad person. Okay, all of us talking right now have had emotional conflicts, but you want resolution of them, and everybody has them. But it's always been taboo if someone says, "Oh, you have that problem." Well, no, everybody has them. Everybody, and it's beautiful when you have all these conflicts resolved, and Liliana's an expert at that. But then all the other treatments that we have here, whether it's hyperbaric oxygen, we know that cancer cells thrive in a low oxygen, acidic, sugary environment. So we have to change that. Fasting is good and easy, fast. Obviously getting off sugar and going on a more of a ketogenic eating program. And then we flood the body with oxygen here. We use hyperbaric, we use ozone, we use oxygen bath, all these things. So we radically are changing the system very well. Now, when we talk about targeted treatments here, we do low dose chemo. We do something called IV salicinium. We have probably 10 other IVs. We do IV artesunate. Artesunate is a herb that kills cancer. We do IV salicinium, which is a vegetable glycone that turns that anaerobic cell into an aerobic cell. We do chemo sometimes. We do low dose chemo using insulin as a Trojan horse to bring the cancer, the chemo into the cancer cells, sparing the healthy cells. Now we've just begun using a laser for cancer. It's an FDA approved German machine that is being used for all different conditions, one of them being cancer. So there's all kinds, we use lots of lymphatic drainage. We have an amazing machine that cleans the lymph. Our lymph removes all the garbage out of our body. So there's so many unbelievable ways, but a lot of times people do it when their head is right. It's amazing. It's amazing what can be accomplished. I've had patients, I had a lady with cancer in both breasts, a grapefruit in here and a plum in here. When she went to the procedure that I had her do, which was cryotherapy, the mass in the right breast was gone, undetectable. So it can be done. I had a patient fly in from Texas today who refused surgery and chemo and radiation. She says, Dr. Connealy, I have never felt this good in my entire life. Wow. All because I've changed just my lifestyle. When I examined her, I felt the breast lump. It was much smaller. So I said, okay, now we're going to go to the next step. Don't let someone fear you into a process that you feel uncomfortable with. Usually cancer is not an emergency. You have time to take into the information, to get peaceful, to change your lifestyle, to change the way you're thinking about this, to just re-examine your entire life so you can say, look, I need to look at all this, look at all my options and see what's the best avenue. Because most of the time, it's not an emergency unless there's an obstruction. But a lot of doctors tell patients they're going to die if they don't do this. Well, we didn't learn in medical school how to give someone an expiration date. And by the way, we never learned in medical school to talk like that to a patient.